My name is Dr. Scot Bay. I'm a psychiatrist and I have an office in Roswell, Georgia. Right. Well, I'm a psychiatrist, as I said, and a lot of people ask me, well, how did you come to that field? What made you decide to do that? And really, this is something I've always known that I wanted to do. Unlike a lot of people who find that they enter into it for different reasons, even as far back as when I was in high school, I knew this is what I wanted to do. People have always felt very comfortable coming to me and talking to me and asking me to help them talk through their problems. I've always enjoyed helping people feel better by helping them talk through things that are bothering them. And not only that, to me, studying the brain is the best part of what I do. I've always wanted to know why things don't work the way they're supposed to. When I was young, if something was broken, I had to figure out how to fix it, or what was wrong with it, or if it couldn't be fixed, why. And there's nothing more complex to me than the brain and how it works, why it is that we think and feel and behave the way that we do. It's all involved in the processes in the brain that make all that happen. So that's why human thought, emotion, and behavior has always been my fascination, and how to help people when they're not feeling or thinking well or necessarily behaving well either. So that's why I do what I do, and I love doing what I do. To me, when someone's not feeling well and they come to me for help with that and I can help them feel better, that's why I do what I do. Well, as in every field of medicine in the past several years, computers have become a major part of medical practice. It started with the movement away from paper and pen medical records to electronic health records. So nowadays, and instead of seeing your doctor writing handwritten notes, they're typing on a computer. And psychiatry, I have to say, has been much slower to adapt to these changes than other fields of medicine. But I can say for myself personally that I definitely think there are advantages to having electronic health records. It's much easier to share records with other physicians, and it's much easier to keep track of important things such as other illnesses patients have, the medications they take from other doctors, and the allergies to medications they have. That way you can avoid adverse interactions between medications. And then as far as prescribing medications, it's now the exception that I handwrite a prescription when I give someone a prescription for their medication. Send those electronically, directly to the pharmacy. And it's all done by software. The patients love it because they no longer have to keep track of these slips of paper and no longer have to worry that they'll be lost. And it even also facilitates getting extra refills when people run out, because the pharmacist can send me an electronic refill request back through the same channel that I send them the prescription. I think the other big impact technology has had in my practice is that when people need specific instructions on how and when to take their medicine with food and without, using electronic health records, it has enabled me to be able to individualize those instructions. And I print them out and hand them to my patient, review them with them before they leave their visit so they know exactly how to take their medicine. And I never want someone to leave their appointment, go home later that day, and say, now, what did he say to do? And unfortunately, studies have shown that people have a hard time remembering much of what happens during a medical appointment. So whether it's instructions with respect to the prescription that they're going to pick up at the pharmacy later that day after they see me, or especially if it's medication samples that I'm going to hand them to try out, it helps so much to be able to just give them tailored, individualized instructions that I don't have to write out by hand. Another avenue the internet can help is there are so many negative sources of information about mental illness, mental health issues, psychiatry, and psychiatric medication. So I can actually show people reputable websites where they can get good, reliable, balanced, accurate information. And another issue is affordability of medications. So I can actually show people places where they can investigate better prices so they can better afford their medication. Or even in some cases, download and print a savings coupon that I can hand them right then and there so they know they can go right to the pharmacy and be much better able to afford their medication. So whereas I think unfortunately a lot of my colleagues have sort of bucked the trend and avoided integrating computers and the internet and technology into their practice, I've embraced it, and I think it's really been a tremendous asset. I think it's helped me do what I do, and I think it enhances patient care. Right. Well, I am an adult psychiatrist, so I see adult patients of all ages, and what I do is called medication management. In other words, I diagnose psychiatric problems and treat them with medication. And that is not to say that I think everyone always needs medication, nor do I feel that psychotherapy and other methods of treating mental health problems don't have tremendous value. I definitely feel they do. But as far as what I specialize in, what I do, that's what I do. So if someone comes to see me, they have a concern or a complaint like they're anxious or they're depressed or they can't focus or concentrate, I will do a thorough, full psychiatric diagnostic evaluation, which includes a full medical history. And based on the symptoms they report to me, the diagnosis that I arrive with, then I will make a recommendation for particular medication to treat their symptoms. However, I think it's important to emphasize, if after I do a full evaluation on someone and I don't think they need medication, I'm not afraid to tell them that. Sometimes I'll say, well, I think the symptoms you have are not serious enough to warrant a trial of medication. In that case, go see a counselor or a therapist, and if you don't improve, then you can come back and see me and we can reconsider a trial of medication. However, for the most part, if someone's coming to see me, for the most part, they've tried other therapies, other treatments, they've tried counseling alone, or they've tried other medications and haven't gotten better, and this is why they're coming to see me. So it is pretty much the exception that someone's coming to see me and not winding up taking medication. But again, I also, because I have such a wide network of excellent therapists in surrounding communities, and I feel very strongly about the value of psychotherapy, in addition to my prescribing medication to help someone feel better, I will also recommend people to go get counseling or therapy to supplement what I'm doing. The medication and therapy usually work best together, better than either one alone. So that's the service I provide. It's called medication management to treat psychiatric illness in adult patients. My mission is to help people who aren't feeling well mentally and emotionally to feel better, and also to further the cause of the profession by treating people effectively as well as ethically, with very, very careful attention to minimizing side effects of treatment, and not just paying attention to medication, but paying attention to all aspects of people's lives that may be affecting their mental health, and finding any and all ways to help people feel better. And that's really what it's all about, is people come to me not feeling well. How can I help them feel better and stay better? Now, another question that we get from patients a lot is, well, so if I have this episode and I take my medication, then I'm done, right? Why should I have to take it longer? Why do some people take their medicine for years and never stop? Well, it's because it turns out that many or most of the things that we psychiatrists treat patients for are like almost all things that people go to see a doctor for. When you get right down to it, most illnesses that someone goes to a doctor for are chronic, long-standing, lifelong things, like the examples we talked about before: diabetes, thyroid disease. There are actually very few things that we cure per se, and I don't mean that to sound hopeless, just pointing out things to explain how this works. For example, you have an inflamed and infected appendix. A surgeon cuts you open, takes it out, sews you back up, you're done. That's it. It's a cure. But when you're talking about things like diabetes, high blood pressure, and so on, what we're doing is not curing it per se. We're maintaining someone's health by prescribing medication. So in psychiatry, we often have to do that. But who are the people who need to be maintained on medicine versus those who are not? Well, this is also very straightforward. After one lifetime episode of, say, a severe depressive illness, someone has at least a 50% chance of having a second. After 2 episodes, someone has about a 70 to 80% chance of having a third. But after 3 lifetime episodes of severe depression, someone has a 90+% chance of having a fourth. So really, when you look at depression, let's say, to use one example in psychiatry, it is an illness that is prone to be recurring and chronic. And therefore, in order to prevent these recurrences, in order to alleviate the suffering from recurring episodes, it's best that someone be maintained on medicine, yes, in many cases, indefinitely, especially if one of the episodes included a suicide attempt. Then you're looking at something that potentially could be life-threatening, and again, that person is much better off staying on their medication indefinitely to prevent recurring episodes. Or even if someone has a very strong genetic history of mental illness, that indicates that it's in their DNA, they're always going to be vulnerable. If someone had never had problems before, they had a very clear, identifiable, severe life stressor that triggered their episode. They resolve their episode, they take their medicine, they go to therapy, they put their life back together. That person is an ideal candidate for gradually tapering off their medicine, stopping it, and they may be fine indefinitely. However, someone with a very strong family history of mental health problems, multiple close relatives who've suffered from illnesses, and their first episode or 2 is triggered by clear, identifiable life stressors, but then they have subsequent episodes that aren't necessarily obviously triggered by any difficulty in their life, but they're happening anyway. That person, on the other hand, is a candidate for regular maintenance medication. Now, again, we don't have the luxury of being able to send someone down to their neighborhood imaging center to do an imaging study to show them what's wrong, but nonetheless, we do know that psychiatric illness stems from problems in the brain. One very common psychiatric syndrome is panic disorder. Now, we don't exactly know what causes panic attacks, but the most cogent theory is that it stems from an abnormal discharge in this area in the brain stem, near the respiratory center, or what triggers our breathing rhythm. It's called the suffocation false alarm theory. And if you've never had a panic attack, then you really can't appreciate what's going on. They're extremely dramatic and scary. People feel like they're smothering, like they cannot breathe, like they cannot get any air. But if you check their oxygen levels, they're perfectly normal. They feel like their heart is about to pound out of their chest. They feel dizzy or lightheaded, queasy. They have this overwhelming sense of dread, like something awful is going to happen to them, like they're going to lose their mind, they're going to have a heart attack and die. They're shaking. It's extremely dramatic and scary. But this is an example where you know an episode like this is triggered by an adverse episode in the brain, and the point of the medication is to prevent something like that from happening. Making an accurate diagnosis. One thing I've learned in my career is, unfortunately, people don't always get the right diagnosis, and much to my chagrin, it may be a colleague of mine who might miss something, not just a primary care physician who, I mean, that's also regrettable that they might miss a proper psychiatric diagnosis, but it's somewhat more understandable since that's not their expertise. But I do a very thorough, detailed interview the first time I see a patient, going over a multitude of psychiatric symptoms, not just what the person is coming in complaining of, but again, I do my own sort of full comprehensive evaluation, asking about all different types of symptoms to make sure nothing is missed. Because if you don't get the diagnosis right, you're not going to get the treatment right. And so really that's very, very important to me, is doing a full interview and getting a comprehensive diagnosis. The other thing that's important in psychiatric practice is the medications we prescribe do potentially have some serious side effects. There are two in particular that are easily considered the most nuisance side effects from psychiatric medications, and that is some of them can make people gain weight, and some of them can also interfere with sexual interest or sexual functioning. And these are also side effects of other medications outside psychiatry, but in psychiatry, those are the two ones that really are the most irksome problems. So again, I try to use the medications that have the least of those issues, but I'm always careful to check with my patients if they're having those problems. And if they are, I'm not afraid to use creative, out-of-the-box solutions to try to avoid or minimize or mitigate or hopefully eliminate those side effects altogether. So for that reason, I tend not to use the medicines as first choice options that other doctors do, because those medications may be more prone to cause those side effects. So instead, I will start with the ones that have the least likely tendency to cause those side effects, and then, if necessary, move on to some of the others that are more popular. Another thing about psychiatric practice and psychiatric medication that I tell people all the time is don't Google your symptoms or your medication. Google is not a good doctor, or any internet search engine. Not going to pick on Google. The problem with doing a broad internet search for looking up things about psychiatric illness or medication is that, again, it gets back to the stigma. Unfortunately, most of what you're going to get back with just an open, broad internet search is very inaccurate, it's unbalanced, and quite frankly, is often biased in a very negative way. Anti-psychiatry, anti-mental health, anti-psychiatric medication. There are those very powerful voices out there. Well, as an office with a psychiatrist, what is different about my psychiatry office than other offices, I guess, is what I'll take that question to mean. I think I try to focus on customer service. So I quite purposely don't have a phone menu when someone calls and say, this is the office of so-and-so. For this, press this. For this, press. People just get very, very frustrated with that from their doctor's offices. So I've quite pointedly turned that service down from my phone company, and we just have a straightforward voicemail with no choices when you pick up the phone. And I strive to streamline things that come in on the phone lines to increase the chances that a live human being will pick up the phone when someone calls. So I limit the number of insurance companies that I do business with, because that means there'll be less phone calls that my office staff is making to and from those companies. I also have a separate phone number that's just for messages for me from my patients. So instead of patients who need to talk to me because there's something urgent, they can't wait till their next appointment, calling the main office line, and again, tying up the phone lines for other things, they have a separate phone number. It's actually not even a phone. It's not even a handset. It's just a voicemail. So that way, messages from patients to me are not clogging up the phone lines. So I'd like to think anyway, I hope, and we have gotten some positive feedback from patients, if I may say so, that it's It's trying to pay more attention to customer service that I think makes my psychiatry office different from others. Individual attention from human beings when they answer the phone. I can't tell you how many times people have given myself and my staff feedback like, you're the only office where a live person picked up the phone, or of all the offices I called to try to make an appointment, you're the only one on my list to actually return my call. So again, that's where I think hopefully we can make the difference compared to other similar practices. I think what I learned from talking about all these things is in going back over how I got to this point, how my education and career evolved, the people who I've learned from and helped me along the way, and the things I've tried to do to run my practice the way I do. It reminds me to keep all these things fresh because after all, it's all about the patient. It's all about taking care of the patient, helping people feel well. And so this has helped me to keep it all fresh, to review what are the things along the way that I've learned about taking care of people and helping them feel well. What have I learned at all the stops along the way in my career as far as how to run a medical practice efficiently for the sake of enhancing patient care, right up to what we talked about in terms of technology, is how medical practice has evolved, how I've evolved along with it and using it in my practice. So this has been very interesting as far as reminding me how I got to the point where I am, keeping everything fresh. And I think what I've learned from it is it's good to keep these things in mind. Always keep things fresh, and that will always hopefully help me stay right on target, which is helping people feel better.